How do we here at Idaho Brain and Body Institute evaluate and manage hypothyroid cases? I'm going to review that with you during this video. First, we're going to start out with what are some of the common symptoms with a low or hypothyroid. Some of the most common symptoms people experience are fatigue, brain fog, dizziness, weight gain, mood changes, changes in bowels, and then hair loss and hair thinning. There are more symptoms beyond that, but that is a beginning list. If you have a lot of those symptoms, there's a good chance you may have a low thyroid. For many of you, you fall in two camps. You know you have a low thyroid because you've been to your doctor and your TSH and T4 have been off and you've been put on a medication. Maybe it's levothyroxine or Synthroid. But despite that, you still feel as if your thyroid's not managed right. And there's a reason for that. Now on the other side, you've been to the doctor, you've had things tested, and you've been told things are normal. There's also a reason for that. For one side, it's because of what's happening within your body. And for the rest of you, it's because there's so much more to a thyroid evaluation than just a TSH and a T4. Here at Idaho Brain and Body Institute, we view you as an entire person. One of the big mistakes we see is that people will hyper-focus on their thyroid and they'll forget that the thyroid doesn't tell itself to produce thyroid hormones. What actually tells the thyroid to produce hormones? That is the brain. So if the brain isn't as healthy as it should be, we cannot expect the thyroid to do its job right. Now, once the thyroid has been told to produce thyroid hormones, it then goes throughout the body. But the thyroid does not produce most of its hormones in an active form. There are other organs in the body that actually have to convert thyroid hormone into a usable form. So it's not enough just say thyroid, let's give you a replacement, or thyroid, let's give you some supplements and have you produce more hormones or give you more hormones for that matter. You need other parts of the body to also be healthy enough to take it and to convert it into active forms. So during this video, we've reviewed common symptoms. We've also reviewed what is needed in a full thyroid evaluation. You really need a comprehensive approach, one where you don't hyper-focus, but you actually work through what causes a thyroid to go low, what is needed for the body to convert thyroid into active steps. And we do that by starting off with a comprehensive evaluation. What does that look like? Well, the evaluation, we're going to evaluate the health of your brain, your body, and your mind. These are all the components needed to have true health. We will also figure out which testing that you need to figure out exactly what is going on. With that information, we then create a customized care plan for you. This is a care plan for you. It's not for everyone else because what's going on in your body is going to be different than what's going on in someone else's body. So no cookie cutter protocols, truly individualized care for each and every one of you. And we're here to support you along the way. If this resonates with you and you say, you know what, this approach sounds like something I'm interested in, then I encourage you to schedule a free health strategy session with one of the staff members, specifically the providers at Idaho Brain and Body Institute. Our team will make sure you're a good fit, and then I look forward to talking with you and helping you get your thyroid health back on track.